Hello, my name is Tracey Woodruff, and I'm a professor at the University of California, San Francisco, and the director of the program on reproductive health and the environment. And I'm going to talk today about female reproductive health and endocrine disrupting chemicals. My objectives today will be to talk about the widespread exposure to endocrine disrupting chemicals, understand that endocrine disrupting chemicals are linked to reproductive health disorders in women, to identify strategies to reduce harmful exposures in your patients and in the public, and to explore additional resources to dig deeper. One of the reasons that scientists and clinicians are concerned about exposure to endocrine disrupting chemicals is because there is an increase in the number of adverse chronic health conditions that we see, particularly for reproductive health outcomes among women. For example, there has been a noted decline in the age of puberty over the last several decades. We are seeing more aggressive breast cancers in young women, and there's been a noted increase in difficulty in conceiving and maintaining pregnancy. And the concern is that there is increasing exposure to endocrine disrupting chemicals as we're seeing an increase in the manufacturing of these chemicals, and that there is a plausible link between the two. I'm going to start with this example of diethylstilbestrol. Diethylstilbestrol, or DES, was a drug that was manufactured in the 1930s to be a synthetic estrogen. It was thought to prevent abortion, miscarriage, and premature labor, and it was prescribed to millions of pregnant women across the United States between the 1940s to 1970. It, however, did not work. It instead led to an increased risk in the daughters of women who were exposed to diethylstilbestrol of a rare form of vaginal cancer. That is because DES is a synthetic estrogen, and it disrupted reproductive development during the prenatal period. DES exposures during pregnancy resulted in adverse effects in female children, including increased risk of vaginal and breast cancer, increased risk of reproductive tract dysfunction, and it also led to a grandchild effect, meaning that the grandchildren of the children that were exposed in the womb had increased risk of ovarian and menstrual irregularities. DES illustrates the importance of hormones in the developmental period, particularly in this case estrogen, but other hormones like testosterone and thyroid that are critical for proper development of the reproductive tract organs. Diethylstilbestrol is a small manufactured molecule. The structure of diethylstilbestrol, which is on the left, is very similar to other small manufactured molecules, which are not pharmaceuticals, but are instead industrial chemicals, or in this case, endocrine disrupting chemicals. These are chemicals like flame retardant chemicals like polybrominated diphenyl ethers that are found in foam, triclosan, which is found in personal care products, and BPA, which is found in many different types of plastics and example in the lining of food containers. U.S. chemical production of these chemicals plus others have been increasing since the 1940s, over 15-fold. Now, these types of chemicals, including endocrine disrupting chemicals, are used in many and different types of products, and they contaminate the many different pathways by which we come into exposure. So, for example, chemicals are in the water we drink, they're in the air we breathe, contaminate the food products we come into contact with, and they're also in many different types of varied consumer products as well as products in our home. They include BPA chemicals, phthalates and parabens, air pollutants, pesticides, and flame retardant chemicals. Also, these exposures are not equal among the population. Many populations can have higher exposure to these endocrine disrupting chemicals, including underserved, and populations of color can have higher exposures to these chemicals because of where they live or because of where they work, because we know that people who work in occupational settings can have higher exposures to many of these endocrine disrupting chemicals. Exposure to endocrine disrupting chemicals, particularly during periods of sensitive times of development, can have an increased risk of different types of female reproductive outcomes. This slide shows that exposures during organogenesis, the neonatal period, the prepubertal period, puberty, reproductive period can be times when exposures to these endocrine disrupting chemicals can increase risk of certain types of female reproductive outcomes. This is because there are particular changes that are occurring during that time, and if you disrupt those changes, that can lead to a change in the development or trajectory of disease. So these are an example of some of those diseases that can be increased risk, including endometriosis, fibroids, early puberty, and polycystic ovarian syndrome. In the population, we know that reproductive health outcomes affect adult women. Women suffer from polycystic ovarian syndrome, somewhere between 5 to 10%, and it is linked to infertility, diabetes, and obesity. We know that a majority of women can suffer uterine fibroids over a lifetime, and that endometriosis also affects a significant portion of women. Endocrine disrupting chemicals have been linked to these and other women's reproductive outcomes. And we also know that exposures to many of these chemicals occur in greater than 80% of the population. This illustrates some of the endocrine disrupting chemicals that have been measured in greater than 80% of reproductive age women or pregnant women, and that they have some evidence linking them to female reproductive health outcomes. These include historical chemicals like organochlorine pesticides, PCBs, and PBDEs, but also currently used chemicals like BPA and parabens, phthalates, and perfluoroalkyl substances. Just want to note that the evidence for endocrine disrupting chemical exposures in health is not quite the same as you might see in clinical medicine. We won't see double-blinded case control studies because these are in large part unethical. The majority of our studies come from animal studies and human observational studies. There are important elements of evidence for us to look at the relationship between exposures and health outcomes. And because of the wealth of data that has been available and growing, the American College of Obstetricians and Gynecologists and the American Society of Reproductive Medicine in 2013 published a committee opinion noting that the evidence that links exposure to toxic environmental agents and adverse reproductive and developmental health outcomes is sufficiently robust. Both ACOG and ASRM joined other leading scientists to call for timely action to identify and reduce exposure to toxic environmental agents. The ACOG-ASRM committee opinion also noted that OBGYNs and other reproductive healthcare professionals don't need to be experts in environmental health to provide useful information to their patients. Some tips they advise are to be familiar with your patient's geographic area, to take an exposure history early. You can also provide information about various aspects of exposures that can affect health and to communicate the signs and areas of uncertainties about environmental exposures. Here's some things that you can tell your patients that are easy, win-win, and evidence-based. Eat organic where possible. Studies show that eating organic diets can lower your exposure to certain types of pesticides and to some other types of endocrine disrupting chemicals. Also limit foods that are high in animal fat and avoid canned foods and beverages as much as you can. Eat fresh or frozen fruits and vegetables. Don't microwave in plastic and try to limit exposure to plastics in general in your food. And wash your hands and take off shoes before you go in the house can lower exposures to endocrine disrupting chemicals that tend to hang out in dust. At UCSF, we have put together a series of brochures that can be given to patients, and we give to all our prenatal patients who come to visit our clinics at UCSF about reducing exposure, simple ways that you can reduce your exposure to endocrine disrupting chemicals and other types of chemicals. In a series of toxic matters, they've also been translated into Spanish. We have a special one for people who have concerns about occupational exposures and advice about how to work within the legal system to protect your health during pregnancy and food matters. Also note that we are very clear that you don't have to be an expert in environmental health to give your patients good advice. The pediatric environmental health specialty units have been created and are in every region in the United States to provide advice and referrals for people who have questions about environmental health concerns. And every pediatric environmental health specialty unit has a reproductive health specialist. Finally, ACOG and ASRM committee opinion noted that individual actions, while important, are not enough. And that is because endocrine disrupting chemical use is used in many different products, many of them which we don't even have control of. For example, if we're concerned about exposure to air pollution, which is, can increase the risk of adverse health effects, we as an individual have difficulty in controlling many of the sources of air pollution. This is from a study that was conducted on a woman named Molly Gray, who did many of the tips that we advised in our brochures. She ate organic, she avoided BPA, she bought natural cleaners. However, in a study that was conducted of pregnant women in Washington, Oregon, and California, they still measured detectable levels of BPA, mercury, phthalates, and perfluoroalkyl substances in her blood. And that's because it's really hard for individuals alone to reduce their exposures to these chemicals. And that's why we need public policies and for clinicians to be advocates on behalf of their patients for public policies that reduce harmful chemical exposures. So in conclusion, exposure to toxic environmental chemicals happens among pregnant women and women of reproductive age, and it's ubiquitous. These exposures can contribute to reproductive health disorders, and women's reproductive health impacts can manifest across the lifespan and even into generations. Health professionals have an important role by working with their patients on prevention, and that preventing exposures to reproductive and endocrine disrupting chemicals requires improved public policies. Thank you.